name is Jean Yeomans. I am the Adult Services Coordinator here at the Hedberg Public Library, and I'd like to welcome you to our program this evening and Hospice Care 101 and Hospice Care Volunteers. We are pleased to introduce Lisa Brown, the Community Relations Manager, and Jamie Brock, Volunteer Coordinator from Hospice Care, Inc. of Rock County. They will share information about the basics of hospice care and becoming a hospice care volunteer. Lisa?
Thank you, Jean, and thank you to the Hedberg Public Library for this opportunity to share our information. I think it's very important, first of all, as we start out, to make sure that all of you are very aware of what hospice is and what hospice care does. So I'm going to give you some brief information about hospice care. First of all, just a quick question. How many of you have heard of or know a little bit about hospice care? Wonderful. Most everybody has heard about hospice care. There are some myths and some misinformations, and so I'm going to help dispel some of those things and give you the correct information about hospice care. First of all, the question I'm most frequently asked is, what exactly is hospice care? Hospice care is comfort and support for people with terminal illness. It also is physical support, so that might be pain management, some symptom management. It might be getting medical equipment into the home that will be able to help that family member feel more comfortable and be able to breathe and be more pain-free. It is also very much emotional support, and that emotional support extends not only to the patient, but also to their family members, and especially their caregivers. So that emotional support is also critical too. And then we don't leave out the spiritual support. When people are facing a life-limiting illness, they often have questions about their spirituality and perhaps what may happen after they die. And so it's very important for them to be able to have some peace of mind and some relief about what their beliefs may be or what their beliefs might have been. And so it's important for a hospice care to provide spiritual support also. Hospice Care Inc. of Rock County has a mission and a vision. Of course, our mission is to enhance the quality of life. Even when somebody is dying, they have goals. They have a reason for wanting to be able to get up every morning, and as much up as they can be. And for them, that might be just getting out of bed for a little bit, might be sitting in a wheelchair for a few minutes, it might be just rolling over a bit in bed, but they still have a goal, and so they still want to make sure that that is good quality time. So we also have a vision, and Hospice Care's vision is to help build a community where exceptional end-of-life care is, number one, accepted, number two, expected, and above all, available to everyone. So again, let me repeat that. Our vision is to help build a community where exceptional end-of-life care is accepted, expected, and available to everyone. And that's really important. We're going to talk a little bit further about that as I go on. The philosophy of hospice care is to meet patients' goals. When hospice care has a referral, we spend a lot of time talking with that patient and with their family. And one of the top questions that is always asked is, what are your goals? Would your goal be to remain at home? Is your goal generally to be very pain-free or as free from pain as possible? Most of the time we hear a goal of not wanting to die alone. Perhaps the goal might be to try to be healthy enough to get through a wedding or a family trip, or to be able to see one more, whatever the event might be. So it is our strive and our goal to, of course, turn around and meet patients' goals. And part of that philosophy is allowing that patient to live life to the fullest. I'm going to tell you just a little bit of a story. When I first started with hospice care, up in our Madison office, there is a hospice restaurant that's there on site that patients and families can choose to order. Of course, it takes care of, it's the kitchen that takes care of providing meals for the families that are staying there. And they talked a little bit, the head chef talked a little bit about the fact that one of the patients that was dying wanted chocolate. A woman after my own heart, she wanted chocolate. And so she decided that she wanted chocolate for breakfast and for lunch and for supper. And the staff made breakfast for her for lunch, and made chocolate for her for breakfast and for lunch and for supper. I thought, that's how I want to die. And something so simple as that is very meaningful. And so that's part of living life to the fullest. She might not have had other opportunities, but she wanted her chocolate, and good for her. And we were able to accommodate that.
There are other gifts of that we can do that we offer through different opportunities. Jamie's going to speak to the volunteer piece, and that's going to be important for everybody to understand, is that when we help patients live life to the fullest, it's not just that patient and that family. It's a whole host of care team, and it's a lot of volunteers that can make that happen, and everybody's wish is different. Of course, we choose to care, and that's our acronym for our vision. We choose to see, care compassionately, and that you'll find in everybody who works at hospice care. We live to make sure that the patient's goals are met. We advocate for quality end-of-life options. That's very important to us to make sure that we are spokespeople for our patients. We also do a lot of advocating with other healthcare partnerships. We respect families, patients, employees, and partners. We couldn't do the work that we do without partners, and we so appreciate them. And E is educating. Of course, educating patients, families, partners, public, and the general community, and media, not only about hospice care, but also end-of-life issues, is critical to the work that we do. A little bit of background history on Hospice Care, Inc. of Rock County is that we have been in this county for over 26 years. We are a state-licensed, Medicare-certified facility. We are a nonprofit organization, and what that means is that when we have fundraising events, all of the funds that are raised at those events turn around and are sunk back into patient services and family care services. And that's really important, that we're not paying for any shareholders, but that all of the donations that we receive go back to the quality of care to make sure that we have a good community that we live in. There are 2 Hospice Care Incorporated campuses. In Rock County, it is out on Memorial Drive past the Country Club. And in our Hospice Care campus, we serve over 100 patients daily. And what people need to know about the Hospice Care Rock County campus is that it is strictly an office building. We do not have beds on site for patient care. All of our patients in Rock County are served in their own homes. And for some people, that home might be a nursing home, it might be an assisted living center, it might be a skilled nursing facility, it might be a daughter's home. So it may not be what you and I would consider perhaps a home. The Dane County campus averages about 300 patients served daily, sometimes a little bit higher, sometimes a little bit lower. And that is on Sherrill Parkway in Madison. Some people also consider that Fitchburg. The nice thing about the Dane County campus is that there are 2 other facilities there that are built right next to each other, conjoined. The Don and Marilyn Anderson Hospice Care Center and the Ellen and Peter Hospice Care Residence. And what's so important about those 2 buildings is that it allows our staff and it allows our patients choices. There are some times when our patients may need to have different levels of care, perhaps more acute care, perhaps some respite care. And so the patients then can go to that campus to be able to get that care. So let me give you an example. Say, for instance, just an example, maybe I'm the primary caregiver of my dad. My dad might have Alzheimer's. So I have a brother getting married out in California. I'd really like to be there for my brother's wedding, but I'm taking care of my dad. Oh, the choice. You don't have to struggle with that choice. I could make sure that my dad gets the quality care. He could stay very short term at the Madison campus. I can go be part of my family, do the things that I need to do, and come back. But meanwhile, as a family member and caregiver, I can know that I'm gone with all of the fact that he's going to have his care he's going to be well taken care of. And that gives me comfort and peace. So people wonder, what is hospice care eligibility? How does somebody get signed up under hospice care services? And there are some criteria. First of all, the patient must have received a diagnosis of a life-limiting illness. And what's important for all of you to know is that that's any terminal disease, not just cancer. Presently, less than 43% of our patients served have cancer. It used to be 20 years ago or 30 years ago, it used to be quite a bit of, almost 100% of cancer patients were served by hospice care, and now less than 43%. And the exciting news about that is that it's because cancer is getting treated earlier, treatments are better, and above all, we're being more proactive to take better care of ourselves, knowing some of the causes or environmental kinds of things that can lead to that. But back to hospice care eligibility. Of course, you must, like I said, have a diagnosis of a life-limiting illness. You must have your physician consideration. We do not sign on any patients unless that has been confirmed through a conversation with the physician. Patients of any age, ethnic background, or religious affiliation can become patients of ours. In recent years, we've had a very newborn child, a child that was just a few days old, all the way up until this spring when I was taking pictures at one of our dear ladies who celebrated her 102nd birthday. So any age level we serve, and again, also any background or religious affiliation. Above all, that patient must be seeking comfort, not curative measures. There are, like I mentioned earlier, a number of illnesses that we care for, certainly first of all cancer, but not limited to. The greatest population of patients that we are seeing are patients with Alzheimer's and dementia. We of course also care for people with lung disease, heart disease, Parkinson's, liver or kidney disease, ALS, congestive heart failure, HIV or AIDS, COPD, which is chronic obstructive pulmonary disease, many others, of course, cancer, and also a new one that has hit the list lately has been failure to thrive. We used to know that as dying of old age, and now the physicians really do consider that a terminal disease, and we're able to treat that. Another question that I'm very frequently asked is who pays for hospice care? Well, quite often people fall under the Medicare coverage. For those that don't fall under the Medicare coverage, they may fall under the Medicaid coverage. And everybody that is eligible for those two benefits are eligible to receive hospice benefits. That's written into that coverage. It's one of the best things the government actually did for health care. There are some people who don't qualify under either one of those coverages, and so in that case, they probably will have their own HMO or their own private health insurance. But there are some people, and we're finding growing numbers of this, there are some people who are underinsured or uninsured. And so in those cases, we certainly rely on community donations to help offset those costs for those patient services. We do, as I mentioned earlier, have a number of fundraising events that hospice care hosts, and we do rely on the communities to support them. We also have a contingency fund, which is a beneficial fund for some of our patients. When I mentioned the young child that we had, the infant that we had, that child happened to be a twin. And when those children were born, that family was not able to afford a crib and a couple of other basic newborn child care supplies. And so because of our contingency fund, our social workers saw that there was a great need for that family, and they took that information, went to the contingency committee, and were able to get some funding approved to help out that family. Another situation, of course, is we're going into colder winter months. Last year we had a couple. The husband was the primary caregiver for his wife. He was injured on a non-work-related injury that forced him to be off of work for some time. So when that was the case, he wasn't receiving a paycheck. Last year was a little bit cold in the winter. So there was some growing tension in the household. The social worker was observing that and chatted with them a little bit about that and discovered that there were some concerns over a couple of months of heating bills. And the concern was if this bill did not get paid, the heat would be turned off, and then of course the wife would not have the electrical, the oxygen, the things that she needed. Again, we were able to take that to our contingency team. They approved that, and we were able to take care of those power bills, to which that couple was grateful. The husband went back to work the next month, and it was not a financial burden for them any longer. Hospice care truly is a gift, and one of the greatest gifts is that no one is denied hospice care and no admission is delayed for financial reasons. Let me just state, though, that no one is denied hospice care as long as they meet those criteria. And again, hospice care accepts patients regardless of their ability to pay. Hospice, as I mentioned, is a great gift, and we believe it's a gift based on the services. And we offer many different services, and they are offered to everybody. But a little bit like a menu at a restaurant, not everybody chooses to have the same services. First of all, at the center of our service is our patient. Whatever we can do to make sure that patient is well cared for is the most important part of the work we do. And that generally is pain and symptom control and management. But there's also that broadening circle around that patient is family and caregiver care. In my specific instance, when my dad was diagnosed with cancer, my mother was the primary caregiver. and the support that hospice care was able to give as she was learning some nursing things that she wasn't very familiar with, and as she was learning a new role as a caregiver was very invaluable to her. So of course that family and caregiver care is very important because most of us aren't very comfortable with that role, and yet we're often thrust into that role, and we'll take it happily so, but we're not always 100% sure that what we're doing is the right thing at the right time. We also offer a variety of services for community care. The largest service that we offer is grief support groups. We offer everything from family services to mother loss groups to men's support group who've lost spouses, all the way up to pet loss groups, because people who are pet owners grieve also. And sometimes what pet owners find is that those losses bring back to life all of those other losses that they've experienced previously. It's a little bit like a peeling of an onion. So all of those other losses are there, and you need to work through those to be able to grieve your pet. And for some people, pets might be the only family they have, and so that loss is very significant. We also have a lot of school partnerships, and that's very important to us to make sure that we have a healthy community. In January of 2007, the beginning of this year, there were over 10 community deaths in a 14-day period of time. It's a lot for different communities to handle in one county. And what hospice care does is we step into some of those grief opportunities as a partnership. We stand shoulder to shoulder, especially with schools, because children grieve very differently. Perhaps there might be a school in which a teacher has died. And so how can a social worker or guidance counselor also help all of those children, but also deal with their own grief as a coworker? And so again, like I mentioned, we stand shoulder to shoulder and offer support. And those events are all handled through donations from the community. We do not get any reimbursements from the schools, and we never go in to say the schools can't handle it, because the schools do a great job of that, but there are definitely times that additional resources are necessary. We also offer a lot of business community events. There are a lot of opportunities for learning in the workplace. As businesses are growing, they're also finding that there's a lot of caregiver issues in the workplace and grieving issues in the workplace. And millions of dollars are being lost. It varies between $71 million and $73 million a year for workplaces to get through loss and caregiving in the workplace in production prices. So that's really important to know that there are costs involved. And so if we can step in and help a business who has a loss perhaps of a coworker, or perhaps some caregiving issues, we can help make this, again, community a better place. So what is the first step to finding out a little bit more about hospice care as far as for my loved one? The first step is simple. It's just a phone call, picking up the telephone and making a phone call requesting information. It's also can be handled by anybody. Anyone can make a referral phone call. It could be me as a family member, a caregiver. It could be you as the person that sits next to somebody at work. It could be you as the patient. We have had patients actually walk in the doors of our office and request information. So anybody can refer, including physicians, nurses, the clergy people that you might know, or coworkers or friends or neighbors. Again, upon a referral, it does not mean that you automatically are considered a hospice care patient, because we do need to meet that criteria of patient consideration and also the other criteria that are there. But above all, the early referral allows for the best care. When our team can come in, meet your family, meet you as a patient, and be able to get you some services early, that's when you will have the best gift of care and the best quality service. Once a referral is made, a nurse will visit, and there'll be an assessment, and so, of course, some paperwork will get filled out. And that meeting will be involved with the patient and the family. And if that is all approved and that person signs on and meets our qualifications, then a team is assigned to that patient. And that's an important team because that will be the person's core care team. And at the center of that team, of course, is the patient and their family, and also their primary care physician. In addition to that, there might be a social worker, a chaplain, of course, a nurse case manager. There might be volunteers. There also might be a CNA that might come in to help with some bathing or some daily living kinds of needs, some of different things like that. So a lot of those things are really important. The biggest part that goes beyond that patient in caring for that person is when that patient has passed away, then there is a bereavement counselor that will follow that family for 13 months. And that's really important, that 13 months. People often say, what's the 13 months? And what's important to note about the 13 months is that gets you past those first birthdays, those first holidays, and of course that first anniversary of that patient's death. And so that's really important that our grief counselors can be there to help that family grieve and continue to be healthy. Of course, we do look at everybody in the community as partners, and we do ask everybody to help us out a little bit. So first of all, we wonder how you can help us and how we can help you. And what we first of all ask you to help promote hospice care. All of you are here tonight because you're looking for more information. And you can now share this perhaps with other people in the community. You might be able to share this with people in your workplace. You might be able to donate perhaps some of your time or some of your resources. And that's always welcome and always appreciated too. But the best thing that people can do is share information. And like I mentioned, there are some myths about hospice care, and I want to just dispel those for just a minute before I turn this over to Jamie. First of all, one myth is that all hospices are created equal, and that is sadly not the case. All hospices are created very differently, and that's because we have different core values, and most of us are independently owned or run. We are a nonprofit organization. We are not aligned with any other healthcare facilities. A number of hospices are aligned with other healthcare facilities. Another myth, like I mentioned earlier, was that all patients have to be cancer patients. And as I mentioned, that's not the case. Less than 43% of our patients are cancer patients. Another myth that I have is that you can only call hospice care when somebody is very, very close to dying. And like I mentioned, the earlier the referral, the better the length of service. So not to discourage calling at all, but if we can get to know the family and be able to help out the family, that really does allow us the best opportunity to help other people. Above all, people do need to know that all of their support is very valuable. Hospice care in Rock County raises nearly $300,000 annually through our fundraising events to cover the costs of patient care and services. Covers also the costs of our grief groups and our support out to the community with businesses and also schools. And again, those dollars go towards patients without private insurance. They go for patients whose expenses are not covered by government aid. And they also help fund those additional services, including grief support services that don't have funding sources. So please know that when you consider a gift of hospice care, you are helping out this community. And you are one of our best partners. Does anybody have any questions just at the moment on this information before I turn it over to Jamie Roth, our volunteer coordinator, to talk about the importance of our valued volunteers? Jamie.
Thank you, Lisa, and thank you for allowing me to come here and speak to you this evening. As Lisa had said about the importance that our volunteers play at hospice care, I'm going to kind of expand on that right now. Volunteers have an equal part in that team that supports the family, the patient, and our hospice care staff. We have two categories of volunteers. We have our organizational volunteers, which would be considered non-patient volunteers, and we also have our patient care volunteers. I'll first kind of touch on the organizational volunteers. The different roles that organizational volunteers can fill would be supporting the staff in the office, whether it be filing, working on projects, assisting with projects, also data entry, computer work. Other non-patient volunteer roles would be some of our patients need prescriptions picked up, but they're not able to go to the local pharmacy to pick it up, so we'll have a volunteer that'll go pick up their prescription and deliver it to their house. They also, we have a nice celebration of life dinners, which are offered to patients and a loved one, where we'll have volunteers that will go pick up at a local restaurant the dinner and take them to their home. Or long-term care facility, whichever it may be. We also have volunteers that will deliver the medical equipment that needs to get into the home, something, maybe a wheelchair or a walker that needs to be picked up and delivered. We also have a local florist who donates a rose, and when one of our patients dies, we have that rose on behalf of hospice care taken to the funeral home. The local florist will deliver to the Janesville funeral homes. However, they do not deliver outside of Janesville. So for those needs, we need volunteers to deliver those outside. The service area that we serve for patients out of the Rock County office includes all of Rock County. Stoughton falls into our service area, as well as portions of Greene and Walworth counties and portions of Jefferson as well. That being said, we need volunteers that are also willing to drive to those communities to get our services out there. As far as our patient care volunteers, we have patient care volunteers that serve our patients both in their private homes as well as the long-term care facilities. Patient care volunteers are crucial to the care that we offer. As Lisa was sharing, if you were, you're the primary caregiver and you're with that loved one round the clock, you may need a break where you need to get away. Maybe you just need to go to the grocery store. Maybe you need to walk around the block. All of those types of things, we can help those patients and their families with volunteers that go into the home. Our patient care volunteers can do a variety of things. Probably the biggest one they do right now would be respite, meaning when the family needs to leave and we supply some, or we have someone that'll go and be with the patient. Companionship is another one. There is kind of this myth that I've heard that just because someone's in a long-term care facility and there's all this staff walking around the hallways and, oh, they can just go in and be with that person. But they are so busy that they can't sit with that loved one. And a lot of times family maybe lives out of town, or they're not able to get to that patient. So it's nice to have someone that can go into the facility and sit there and be that caring presence with their loved one, or with the patient. Other roles that they can fill is transportation. These patients need to get to the doctor's appointments. Maybe it's something fun like going to lunch or going shopping. There's a lot of things that our volunteers can do to enrich that person's life. That's also why it's nice if we can sign on patients before they get too far along in their disease process, because the sooner we get them on, the sooner we can support them in a lot of other ways. We have some other programs that once someone is a patient care volunteer that they can also participate in. Is we have a facility team program, and that's where we have volunteers that are assigned to specific facilities in our service area, and we have shifts that they can sign up for. Our volunteers are busy people. They're busy for us at hospice care, but they're also busy in general. A lot of times you'll find that the best volunteers are people that just like to help out. So we've kind of designed a program where they can sign up for shifts and say, Saturdays work well for me. The facility said, oh, it'd be wonderful to have volunteers here on Saturdays. And we've worked out a facility team program where the volunteers sign up for the shifts they like, and it gives them some flexibility in their scheduling as well. We also have a life review program where we have volunteers that will ask questions. They have a list of questions that they ask of patients that have been determined to be a good candidate for a life review program. And they ask questions, and they record the story of these people. They capture the wonderful lives that they have led. And then we also have volunteers that take the information that's been recorded, and through projects we turn them into, whether it's a recording, it could also be a written story, it could also be a picture memory book of that person's life. We also have bereavement volunteers. Those are the volunteers, patient care volunteers, that once the loved one has died, that they help support the survivors. They work with our grief department and they help support the survivors that way. To become a hospice care volunteer, and we really need more volunteers. We currently serve over 100 patients a day, and we have approximately 40 patient care volunteers. So that we have a lot of volunteers that are seeing obviously more than one patient so that we can help these families. All volunteers, if you'd like to be a volunteer at hospice care, all volunteers, no matter if you're organizational or patient care, you must go through a two-hour orientation that kind of gives you an overview and talks about the Health Privacy Acts and things like that, just so that you're well supported in that organizational role. Once you are finished with the orientation, then you can jump right into helping out the office staff with different things. You can also then help us with deliveries. If you want to continue on to be a patient care volunteer, you need to go through an additional 20 hours of training. We're very proud of our volunteer training. We use our social workers, our RNs, our chaplains. We get the experts in their fields, and we give all of our volunteers in training information on the family dynamics of what families are going through, symptom management, dementia, facilities, spirituality, transfer techniques. It's just a lot of information. And that helps support our volunteers so that they feel comfortable in the role they're going to have in these families' lives as they're on this journey. At the same time, it also gives them information on what all of the other staff does. And that allows them to know that, you know what, this is what my role is, and these are what all the other roles are. So we're very proud of that. We are going to be offering training again in January 2008 in Janesville. So if you are interested in that, please contact us. And I need to add on to here also, once you go through the 20 hours of training, you are now able to be a patient care volunteer. If you'd like to be a life review volunteer, where you would go in and interview the patients, you would need to do an additional 6 hours of training there. If you would like to be a bereavement volunteer and work with our grief services department, there would be a couple additional hours of training as well. So our volunteers are very well trained, and that also brings great comfort to our families and our patients as well, knowing that everyone has really knows, and we're really proud of what our team is doing. At this time, I also need to touch base with you on the ages. If you want to be an organizational volunteer, the ages are 14 years and older. If you'd like to be a facilities volunteer, where you go into the facilities, we actually open it up to the ages of 16 and over. And for our patient care volunteers that would be going into people's private homes, it's ages 18 and over. So at this time, are there any questions as far as what our volunteers do? Oh, the quilt here behind us is part of our grief services department. It's something that they put along with our remembrance, our holiday remembrance, where we have programs. For this one happens to be for our youth, and families come in and they're offered, well, they don't have to be a hospice care patient, but through our grief services, if anyone has gone through our grief services, they have quilt squares that they can make a quilt square, and then we have a dedication in the spring at our quilt dedication. So, any other questions or anything? Okay. Well, I want to thank you again for having Lisa and I here today to share with you about what Hospice Care Inc. is and can do for patients and their families, as well as the community, and also for those people interested in volunteering at Hospice Care. We'd love to talk to you, and thank you very much.